Welcome back. We're at the Beebout Veterinary Medical Center. Dr. Brandon Beebout, another very special guest this week. Who are we talking with today?
Our case spotlight of the day is Poppy.
Hi, Poppy.
So,
okay, talk a little about Poppy's story.
So she is 6 months old, brand new to us, a little Bernedoodle. And so she, Saturday night, just had an accident. She went down the stairs at a little bit too fast of a pace, and she actually broke both front legs. So both front legs, radius ulna, kind of our arm bones, our forearm here. And so she presented on emergency on a Saturday night to my wife, Dr. Pao, and we got her set up for surgery on Monday, and we ended up putting 2 plates on. So we did both legs, obviously both arms on the Monday morning, and she is exactly 30 days out, and as you'll kind of see in some of our footage, that she's already back to wanting to be brand new and running around. She still has about 3-4 weeks left of healing, but she can walk as if nothing happened right now. And she's young, so she's got great healing properties for broken bones, and so she should heal pretty quick. And you can even see that she still is shaved a little bit.
Yeah.
So she's early on yet, but obviously doing fantastic.
So how important is it to get in right away when you notice something like that?
We see it kind of on a whole spectrum. Obviously, right away, broken bones, you think, ow, that hurts. I want to get some pain meds. And then, we get you splinted for the 36 hours or whatever until we get you into the surgery table. We see lots of hit by cars where there's fractures where, hey, we're worried about the lungs and the blood in the abdomen and those type of things that take precedent. And so you stabilize them until you can get them in surgery. But, we routinely see, referrals from other rural areas where, hey, this happened 10 days ago. Is it still able to be fixed? You'd be surprised, and just we hear things of like they had to re-break it. You breaking down a callus potentially, and then getting a strong fixation with plates. And, years ago, actually a personal story, when I was a kid working at Hilltop Pet Clinic, we had the same thing happen. A little Italian greyhound, tiny little bones. And it had splinted on both front legs because they were unable to go to Kansas State or Omaha. Just thought that was probably in their wheelhouse financially, which I totally understand. Another reason for insurance, everybody out there, you never know what's going to happen. You got a 4-month-old doggy here, and then all of a sudden she falls down the stairs and breaks both front legs. And that dog we ended up losing that dog because after the weeks of the splint, we took those splints off, and they were actually compounded fractures. And we know just with the physiology of smaller breeds, especially, they have poor what's called metaphyseal circulation, and so they're difficult to heal, the distal radius ulna. And so you can splint them all you want, and lots of times they don't heal. And so then we run into things like amputation, and that word is not in my vocabulary unless it's absolutely necessary for like a cancerous process. And so this is my favorite thing to do, is put kids like this back together. I don't wish it upon my worst enemy, but we know this happens. We see lots of fractures, lots of ACLs. I love orthopedics. I adore it. And then just watching this kid come sprinting in with their shaved little legs obviously warms the heart.
Okay, so the plate, will it stay in there? Will it grow and heal with the whole process as she grows?
And if we took an x-ray today, she'd already have tons of callus. And so it's a race to the finish line. One of two things are going to happen. The plate's going to break or the bone's going to heal.
Okay.
And so the forces are 100% on that plate day one. As we move through time over those 6 to 8 weeks, as bone healing process takes place, that percentage drops to 0 and 100% goes on the bone. And then that plate is inert. Now, if that plate ever got infected, or you could, if you wanted to, you could go in there and take that plate off.
Okay.
We couldn't yet, but in a couple months, you could technically take it, but there's no reason to, so it'll live with her. She's going to have some hardware with her forever, unless she were to need like an MRI or something, and then you could go in there and you could take that stuff off. And sometimes in toy breeds, they will go through something called stress protection, where it's such a solid fixation. It's kind of an anomaly in small dogs where they forget that they had a fracture to begin with, and they'll actually decrease bone. And so you can potentially stage the removal, take out a few screws, put on a splint, and we kind of stage the removal of that. I've never run into that yet, but that'd be kind of your teacup dogs and those type of things. But nope, you're going to keep those forever.
Full recovery then.
She's already a month out, and honestly was walking around 5 days later because she doesn't know, because the plate's got the forces, and it's just transitioning over time without her even knowing.
Wonderful. Well, congratulations and good job. Thank you, Doc. Appreciate it. All right, stay with us next week as we bring you another edition of Pet Doc.